So how did I get into exercise? I used to be a figure skater, and skating and being an athlete and also being a track athlete, I noticed that when I was actively involved in training, I performed a lot better in school. And when there was downtime, I didn't do so good. So there was some linkage there between my training and being active and performing in school. So I'd like to begin with at least just describing anxiety, because we've all felt it and we know it's an end result from stress. It's an unpleasant emotional state which accompanies by fatiguing, exhausting physiological symptoms. So the increase in heart rate, increased blood pressure. In the more extreme cases, headaches, could be nausea, vomiting. And then the very extreme of all this is the people who have panic disorders. When you think of anxiety, there's two forms. There's state anxiety, which is an acute transient response to an event or stimulus. So when someone's having an exam or going to write an exam or write a paper or do public speaking, they may experience a state anxiety. And then there's trait anxiety. So some individuals just by nature tend to be more anxious. So it's a chronic long-term tendency to be anxious. Now, it's really hard to find a lot of information in the literature on studies looking at anxiety. A lot of studies look at depression, but studies that look at using the diagnostic criterion, and those type of studies aren't available. There's studies that have looked at state trait anxiety inventory scales and profile of mood states to assess anxiety. So of these studies, acute exercise, just going out to do a bout of exercise, has been shown to have the same amount of reduction in feelings of anxiety as meditation or just sitting in a quiet room and reading. If you look at exercise training or chronic training over 7 or 8 weeks, we find that aerobic activity, walking or jogging, compared to strength training, have similar decreases in anxiety. In another study that's looked at basically aerobic exercise with groups that looked at anxiety management versus control, both aerobic exercise and anxiety management have led to a decrease in state anxiety. But only anxiety management led to a decrease in trait anxiety. So trait anxiety is a little more harder to control than the state anxiety, in particular if you're using exercise as an intervention. And panic disorder is an entirely other can of worms, so to speak, but we'll talk about that later. How many of you have heard or thought of exercise as medicine? Oh, good. In 2009, American College of Sports Medicine, the World Health Organization, have started a worldwide initiative to have all healthcare providers actually believe and encourage as exercise as medicine. And it's based on the idea that physical activity is an integral part to health promotion, as well as disease prevention and treatment. So the corollary to that is basically what happens when we're inactive. And there's a cluster of diseases that's now termed the disease zone of inactivity. And those diseases include depression, anxiety, dementia, cardiovascular disease, obesity, diabetes, cancer, and in particular breast and colon cancer that have been linked to being inactive. So what can we do in terms of prescribing activity to promote health? Well, each of the different continents have established guidelines, mostly for cardiovascular health. It also has applications to reducing stress, but those guidelines are to participate in 150 minutes of moderate activity per week, and that's 30 minutes 5 times a week. And moderate activity would be a heart rate that ranges between 50 to 70% of what our maximum heart rate is, and on average that's 220 minus your age, so you'd multiply that by 50 to 70 to find out what heart rate you should be exercising at. Ratings of perceived exertion is another way. That's basically how you feel overall when you're exercising, and that ranges between 11 to 13. So something that's fairly light to somewhat hard is how you should be feeling when you're exercising, or being able to do the talk test. So exercising with a buddy and being able to converse with that person while you're exercising, you're still doing moderate activity. If you're a highly fit individual and can exercise at a higher intensity, 60 to 75 minutes of activity is all we really need. So you can see that there's a bit of a dose-response curve when it comes to exercise, and in the different groups of people that I've worked with, this dose response and prescription is not always the same, and you'll also see that with prescription to reduce anxiety. We have a very low dose where there's minimal effects. There's then the optimal amount of activity. And then if you do too much, you get into overtraining and staleness. So too much activity isn't good. And it can even lead to illnesses, colds and other types of infection. So I looked at a meta-analysis of studies that looked at 49 randomized controlled trials looking at exercises to help alleviate anxiety. And actually the FIT principle, which is frequency, intensity, type, and duration of activity or time, that prescription is 3 to 4 times per week of actually high intensity activity. So that's 70 to 89% of our maximal heart rate. It should be aerobic. Aerobic actually, even the one study I mentioned earlier says there's benefits with strength training. We have more reduction in state anxiety, in particular with aerobic exercise. If we combine that with some strength training, we also have benefits. And interestingly enough, anaerobic, and that's very high intensity activity, has a huge amount of benefits. But we have to do this for a prolonged period of time. So the best bang for the buck, so to speak, is 61 to 90 minutes of activity, and you can't do high intensity exercise for that long. So if you have to do high intensity, 1 to 30 minutes will also have an effect, and the effect size is about 40% reduction. If you do an acute bout of exercise, you get the same amount, a 40% reduction of your anxiety level, and if you exercise 4 to 9 weeks, about 60% reduction in how you respond to an acute stressor. It decreases the amount of anxiety that you can experience. So why does it work then? We have this prescription now, there must be some mechanisms, and it's basically an integrated psychobiological model. Psychological mechanisms include, first of all, distraction theory. Exercise is really good as a distraction. It allows for diversion from unpleasant stimuli or thinking things that you're constantly worried about. It gives us a mechanism to think about something else. And if you think about trying to do a sport or an activity you may not be used to, for me it's skiing, I can only think about skiing. I can't think of other activity. So it's, in a way, meditation in motion. It's repeatedly repeating movements, but focusing on the movements and not thinking about distracting thoughts. Another mechanism is the mastery hypothesis, so that if you master physical skill, you then can have a feeling of control in other aspects of your life. There's a social interaction hypothesis where our social relationships and mutual support provides the beneficial effects of exercise. So you have someone to work with and there's support and you know there's a buddy there for you. Or even self-efficacy. And that's having confidence in your own abilities to exercise is related to the actual ability to be able to exercise. On the physiological side, though, there's also adaptations. And as we heard earlier from Dr. Mackey, there's increases in the release of mood-enhancing neurotransmitters, so dopamine and serotonin. Those neurotransmitters are increased with activity. Your endorphins are also pumped up, so exercise helps increase your endorphins, decreasing pain. It's kind of like the runner's high, but not the full-blown aspect of that. There's also a thermogenic hypothesis, which basically proposes that the increase in body temperature makes you have an improvement in your mood state. And then lastly, some impulses. The visceral afferent feedback hypothesis is basically there's impulses from muscular and autonomic activity that changes how we feel. But I think the bottom line is when we exercise, we are using those hormones that have made us feel like we're stressed. We can actually use that energy that our body is preparing us to fight and flight. We're actually fleeing in the form of activity. So how can you get started? I think the first thing, if you have not exercised for a while or if you have a chronic disease, it's really important to consult with your doctor first, in particular if you have diabetes, because you have to balance your blood sugar and your insulin levels. Another thing you should do is walk before you run. You want a very gradual increase. And pick an activity that you really enjoy, such as walking the stairs, jogging, cycling, yoga, tai chi, swimming. All of the above will induce benefits. It doesn't necessarily have to be running. And also make time to move. I find people that schedule a time in their daily activities consistently at the same time is ideal. That doesn't always work, but they're much more successful in maintaining their activity patterns. And once you get going, how do you keep it up? Set SMART goals. Your goals should be specific, they should be manageable, they should be attainable. They should be realistic and also time limited. Find a friend. It's always encouraging to meet someone at the gym or at the park to carry out your activity. Or if you haven't got a person, having a pet to walk. A dog is a really great example. A buddy to basically do your activity with. If you're already an athlete, changing your routine is really helpful. And then lastly, increase in increments. So often people try to begin an exercise program and it doesn't work because they do too much too early and end up hurting themselves and giving up. So gradually increase your activity. So 30 minutes can be actually broken down into 3 10-minute bouts throughout the day. So overall, from all of this, I hope you get the take-home message that regular physical activity can have an important role in alleviating your symptoms of anxiety. Regular physical activity is as effective as psychotherapy, meditation, and yoga. And both aerobic and strength training are effective in reducing anxiety symptoms. You get a greater bang for the buck with aerobic exercise training, however. And when you think of the 2 types of anxiety that I talked about, state anxiety will improve with acute exercise. With chronic exercise training, our ability to respond to a stressor is better. It's more manageable and controlled. Trait anxiety is a bit different. Trait anxiety can improve with chronic exercise. However, it has to be at least 21 minutes per day, and it has to last for at least 10 weeks. So begin an exercise program to see any benefits on trait anxiety. It's more prolonged. And lastly, people who suffer from panic attacks can also benefit from exercise. The biggest drawback with people who have panic or panic disorder is that they're afraid something might happen if they exercise. So short duration studies have shown no benefits, but longer duration activity helps also reduce the symptoms associated with panic attacks. That's it for today.